Have you guys watched Dr. Phil's recent episode regarding Ozempic? Well, if not, let me show you a few parts of it.
The diet trend sweeping Hollywood and social media is taking diabetes drugs to lose weight fast. Kim Kardashian is rumored to have taken them to fit into the Marilyn Monroe dress she wore to the Met Ball, and Chelsea Handler joked at the Grammys that everyone she knows is on it. Now, Lauren joins us on stage, and Haley, who joins us virtually, were both prescribed a diabetes drug off-label for weight loss. Both had very serious reactions, and both ended up in the hospital.
Ozempic with side effects? Well, I think I did warn you guys.
Haley, let me start with you. Tell us, just in summary fashion, what happened.
In October of 21, I saw a functional med doctor, and I was told after labs I was insulin resistant. I was recommended to take the semaglutide, which is the generic brand of Ozempic. So I started taking that, and lo and behold, I got very sick, nauseous, vomiting, hunched over in pain, heating pad in my gut, could barely make it to work. I was tachycardic. I would get up from the couch and go to the kitchen, and my heart rate was pounding out of my chest. I ended up in the hospital because
Hang on a second.
No.
Hang on a second. Even though it made you sick and put you in the hospital, you continued to take it at a lower dose?
I did. I was listening as a professional.
Okay. Now, Lauren, you had a similar experience to Haley, right?
Yes.
And you also ended up in the hospital, but your reaction was much more immediate.
Yes.
What happened?
When I started it, I got very, very sick. It was too high of a dose. I couldn't control my nausea, vomiting. It triggered my gastritis. I was in unbelievable pain, checked into the hospital, and that was what it was about. But I actually, what a lot of people don't know is that Ozempic also comes in a generic brand called semaglutide. So that it's not in these dose pens. So it's also cheaper, by the way. And your doctor can then titrate you properly based on your weight. So I'm actually back on it, but I'm on it in a very small amount, and it's very slow.
So it puts you in the hospital, but you're back on it.
I am, but on a very small amount.
That's interesting to me that something made you sick. Did they tell either of you about potential side effects?
I had it a while back. So one of the reasons why I went on it is just like I'm a psychotherapist, and a lot of my patients were because of the shutdowns, they were eating, they were drinking too much, they weren't exercising, and when they went back to work and around other people and dating again, they wanted to lose weight.
Sure.
So that was sort of the reason why I did it. And it was a long time ago, so it was before all the social media has come out with all these warnings about people having the same side effects that Haley and I are having.
And like she said, I was on it way before it got very popular, and I'm actually not on it anymore. I substitute now with fasting and fiber.
Hold on, did I hear that correct? Fasting and fibers?
I substitute now with fasting and fiber. I go back to what people did in the day, and I got my insulin levels down with that.
Dr. Nazarian, you say this is a frightening trend, and I'm curious, what happens when they come off of this?
Yeah, it's a frightening trend because people are seeing it on TV and they're like, wow, this worked. These medications are powerful medications. They're not for everyone. You can have many side effects, including gallbladder disease, gallstones, leading to cholecystitis, pancreatitis. There's a contraindication if you have a family history of thyroid cancer not to take it.
Fasting and fibers. That's what Hale said. If you want to know more, then follow me and send me a message.